Welcome to the Medscape Nursing CME Continuing Education Program podcast. My name is Franklin Miller-Baum. It's recommended that after listening, you review print material online or in hard copy before completing the CME test procedure. This program is valid for credit through 4/11/2013. 1.25 contact hours in the area of pharmacology. The Medscape Nursing CME Continuing Education Program podcasts brought to you by Georgetown University. Advance your nursing career with a master's from Nursing at Georgetown. Correcting Anemia in New Dialysis Patients, authored by Paula J. Dutka, RN, MSN, CNN. Ms. Dutka will be available to answer questions and address comments through the online Medscape forum. Join the forum by clicking on Join the Discussion button on the appropriate online article page. This activity is intended for nephrology nurses, advanced practitioners, and anemia nurse managers. The goal of this activity is to help nephrology nurses stay abreast of the emerging data and strategies on the management of anemia in patients receiving dialysis, and staying abreast of the role of nephrology nurses and/or anemia managers in dialysis units. Upon completion of this activity, participants will be able to 1. Summarize the role of the nephrology nurse in the management of anemia and administration of therapy in dialysis units. 2. Describe the impact of anemia management protocols on hemoglobin outcomes. Patient case. The report. CJ is a 33-year-old white female who has had chronic kidney disease, CKD, for 10 years and began receiving chronic maintenance hemodialysis 6 months ago. She has a history of hypertension, gastroesophageal reflux disease, headaches, frequent urinary tract infections, diverticulitis, hematuria, and anemia of CKD. She has had an arteriovenous fistula placed in her left arm 2 weeks before hemodialysis began. This has been used successfully for dialysis access over the past 5 months with good function and no cannulation difficulties. Her current plan of care involves hemodialysis 3 times a week lasting 4 hours with 2,500 units of heparin per total treatment dose. Her arterial blood flow is 400 milliliters per minute with 15-gauge needles. Her blood pressure is maintained with 50 milligrams per day of losartan. Her anemia is managed with 25 to 50 micrograms of darbepoetin alpha and 62.5 milligrams of intravenous IV iron each week, the iron sodium ferric gluconate complex. Her blood pressure readings are in the range of 120 to 130 millimeters of mercury systolic and 80 to 90 millimeters of mercury diastolic. She tolerates hemodialysis treatments well. Adequacy indices show urea reduction ratio of 76 to 78. Her hemoglobin, HB, ranges from 10.5 to 11.0 grams per deciliter.